Hello everyone, today we are talking about vitamin C foods. Yes, foods that are rich in vitamin C, and we are going to talk about what does really vitamin C do anyway, and we are going to talk about how to get the maximum benefit from vitamin C, especially from the foods. I am Dr. Ahmet Ergin. I'm an endocrinologist, a diabetes expert, and today we are going into vitamin C. So guys, before we jump to the topic, I want to encourage you to take the quiz in the description below to win a chapter from my diabetes book. Let's move on. So guys, vitamin C is involved in growth and repair. It helps the collagen formation. It helps your body's immune response. It's a great antioxidant, so it prevents cancer and so forth. And it helps with insulin resistance as well. Now, do you really need vitamin C? Well, the vitamin C is common in foods, in good foods. What are they? Let's go over them right now, one by one, because I know not all of you are the same. Some of you like some foods better than the other foods. So let's dive into the foods rich in vitamin C first. And we will go over some concerns, or I'm going to caution you with certain things about vitamin C that you need to know so you do not overdo it. But let's get into the foods first. So guys, vitamin C is found in berries, citrus fruits, green vegetables. Well, the great sources among the green vegetables are asparagus, avocados, the beets, blackcurrants, broccoli, Brussels sprouts, cantaloupe, collards, dulse, grapefruit, kale, lemons, mangoes, mustard greens, onions, oranges, papayas, green peas, sweet peppers, persimmons, pineapple, radishes, spinach, strawberries, tomatoes, turnip greens. So guys, or the girls, or the ladies, one of my viewers said,
"You always say guys, that's so annoying."
When I say guys, I mean all of you. You know, guys and girls and ladies and gentlemen. Just to make it informal. So, but the bottom line is, yeah, so most people go for, when I say vitamin C, they go for orange juice. Well, freshly squeezed orange juice is okay, but when you have diabetes, that can really hit you hard. So you have to be very careful about the amount you're getting. So, but as I said, the vitamin C is so common in so many other foods, you don't necessarily need to drink that orange juice. Plus, we talked about this before, we don't want to do processed oranges, or orange juices at all. So, a few comments about the vitamin C. You know, a lot of people use vitamin C to help prevent the common colds, but the studies again and again shows that actually it doesn't really help much with preventing the colds. But if you have the cold, and having vitamin C extra can help reduce the number of days that you're having cold. And as you know, when you have cold, your diabetes goes off the chart. You know, anytime you're sick, your body's under stress. When you're under stress, your body squeezes a lot of cortisol. When you squeeze a lot of cortisol, any physical or mental stress, you are in trouble. Your blood sugar will be high. And anytime you're under stress, your body needs more antioxidants. And there you go, vitamin C helps there. It can help your, let's say, your common cold. Instead of 7 days, it can reduce it down to 5 days, which is, if you think about it, 2 days of not having a common cold is pretty good deal, actually. Now, who are really vitamin C deficient or more likely? Well, the guys and girls who drink alcohol and the smokers are more likely than anyone else. If you are on analgesics, like painkillers, if you are on antidepressants, anticoagulants, contraceptives, the steroids, all these things can deplete your vitamin C levels, and that, as a result, if you are on these agents, you may want to use more vitamin C. So what are the caution? Well, the caution is this. When you overdo the vitamin C, especially more than 2,000 milligrams, actually it can turn it against you and do the exact opposite. Instead of becoming an antioxidant, it creates oxidative damage. Again, I always talk about the moderation. You know, if you are deficient, you're in trouble. If you overdo it, you're in trouble. So don't overdo it. So never ever exceed more than 500 milligrams. Now, what is another problem with vitamin C? Well, if you are taking more than 500 milligrams of vitamin C, especially glucose sensor users, you know, those sensors that you don't have to do finger sticks and stuff, they are affected from excessive vitamin C. More than 500 milligrams a day tend to cause high blood sugar readings, falsely high. So actually you may be low, but it may actually show high. So that may not be great for you because, you know, you want to know when you're low, and it may cause under treatment of low blood sugars. Or if you're taking aspirin, for example, for cardiovascular risk reduction, and if you take vitamin C together, it can cause a lot of stomach irritation, can cause ulcers, reflux, and problems like that, which you may already have. So you may want to make sure that if you're on aspirin, at least take vitamin C in low dose, or just take it from the food instead of taking a supplement, which can cause stomach irritation. If you're pregnant, you don't want to take too much vitamin C because you may cause your baby to become dependent on vitamin C. If you're taking excessive vitamin C during pregnancy, then your baby may end up with problems like scurvy due to dependence on excessive vitamin C. And avoid using chewable vitamin C because they can cause enamel problems like gum line problems. So that's another thing that I have to caution you about. But the bottom line, overall, having around 100 milligrams of vitamin C, especially from the foods we discussed, definitely helps. If you are not a vegetable and fruit person and you're a steak and potato type of guy or girl, you may want to take some vitamin C. Esterified vitamin C appears to be a little bit better. But guys, vitamin C needs to be taken in moderation, not too much, less than 500 milligram a day in total, and that can help lower your blood sugars a little bit as well, not drastically by any means, but if you're especially deficient, can help your insulin resistance, and we talked about the other benefits and risks. So guys, I hope that video helps. Remember to give a thumbs up and share, and we'll see you in the next video. Hey guys, I hope you're enjoying this channel so far, and I hope you subscribed already. If you didn't, do it, and if you did, watch this video right there. I think that will help you too.